I had been a general dentist for about 10 years. When I graduated from my endodontic program, I knew that I wanted to look at ownership. My husband and I and family moved to Duluth. It was a family decision, and I purchased a retiring endodontist practice.
Good afternoon, John.
I see probably about 6 treatments a day, and I have a team of 4 staff members. Very proud of my team. They are what make me successful. The 2 main reasons that I looked at partnering were a bigger, broader net to bring an associate to Duluth, as well as having some financial security with the practice, as well as for my family. It was very appealing to me that I find a group that was going to help me with those certain things, as the dental specialist does. I wanted to make sure that my team members were going to be treated equitably in the transaction, and that was something that happened as well. As far as systems, I have every piece of equipment that I could need or want. My team is able to communicate with either a mentor or someone within a phone call to get things fixed or addressed. They are very good about compensating my staff and the benefits that I could not give my team members. When I joined the dental specialist, I wanted to continue to run my practice as the doctor in charge, and that's really what's happened. Nothing has changed in my practice as far as how I treat the patient, from the greeting to the exit. Everything has remained the same. My clinical autonomy is the same as it was when I owned the practice myself. In fact, it's actually improved for me because now I have partners. They're just an email away, and so I utilize that quite a bit. So I would say my patient care has probably improved in a couple of ways. I've been able to slow down a little bit so that I can spend a tiny little bit more time with my patients. Get to know your patient just a little bit. Things go a little bit more smoothly for you. As a dentist, I'm thrilled that they keep track of my continuing education. We have a plethora of continuing education online. I joined the dental specialist in October of 2019. I will be honest, I was worried about what was going to happen. I didn't know how my referring doctors were going to handle my transition, but I've been pleasantly surprised. I would say that overall my practice continues to get the referrals it did. Associating with the dental specialist did not decrease my referrals at all. Nothing in my practice and how I practice changed, just the name. I know some people, especially if they've owned their practice their whole career, are worried about selling out because they're not going to be able to have the say anymore. And I would allay their fears and tell them that that's not at all what I've seen in my transition with. Bringing my practice into the dental specialist organization has exceeded my expectations. It's been an experience that I wouldn't trade.